Hello, my well-being buddies. It's me, Steve, your mental health nurse, and today we are looking at dissociation or dissociative disorders. So let's get into this. We're going to look at what they are. We're going to look at some of the risks. We'll look at how they're assessed. We'll look at some of the treatment options, and then we'll discuss some of the medication. So just to get into this, really, what is a dissociative disorder? Well, dissociative disorders are a group of mental health conditions characterized by the disruption or change in the individual's normal sense of identity, memory, or consciousness. So these disruptions may be triggered through traumatic events. So again, that could be a PTSD piece, flashback, or through some kind of DID disorder, that identity disorder piece. There are several types of dissociation disorders, and it's important to recognize that they all have different traits. But what you're looking for is dissociative disorder, which is really, it impacts people's individual lives, work, relationship, concentration, and schooling. And basically what happens is they can just zone out. So it's like a bit of an absence, but it's a condition where they could experience memory loss, time relapse, or they could experience different personality states, or alternatively, they can look at kind of almost a separation from their own body and their surroundings. So it could be a real problem here, right? And obviously, looking then at the risks that are associated to this, the risks are going to be around physical health, for example. So generally speaking, people that have dissociation disorders can have poor sleep, poor nutrition, and could be or maybe substance misuse to manage the symptoms. Again, so that leads to things like obesity, heart disease, and diabetes. They are at risk of other mental health disorders. So you've got your dissociation bit going on, but that is definitely going to cause things like mood, around depression, anxiety, that constant worrying what is going to happen now, or even PTSD, that post-traumatic stress disorder piece. It clearly puts a strain in relationships, family and friends, because watching a dissociative episode can happen really quickly. It can happen at the most inappropriate times. And I've known people to dissociate for seconds, minutes, hours, days, weeks, and even months. So it's a real problem because then that affects their ability to work, social, legal, and financial. So lots of risks associated with dissociation disorders. So how are they assessed? Well, again, with all of these kind of diagnoses, it's a clinical interview to assess the signs and symptoms. And here we're looking at the impact on daily functioning, and there needs to be a severity in the dissociation episodes causing a problem there around the daily functioning. There's a review of the medical history, so ruling out any other mental health disorders and physical health as well. There is going to be some trauma history here, so looking at the history around trauma, whether that's abuse or neglect, and then what triggers those dissociative symptoms. And again, that could be stress related, anxiety, not sleeping, poor lifestyle. There are some psychology testings available, so clinicians could administer some psychology tests to help measure the level of cognitive functioning and their emotional state. The observational assessments, again, if you think about our mental state examination, we'll carry those out and just make sure that that's all in aligned. The DM5 and ICD-11 criteria for dissociative disorders looks at confusion. The criteria includes significant distress, impairment in social and occupational areas, and that executive functioning piece. It's important to note that assessments for dissociative disorders are quite complex and therefore should normally be done through secondary care. So it's unlikely you'll ever get a diagnosis. It's not unlikely you won't get a diagnosis in a primary care setting. This is definitely secondary care. So then we look at what the treatment options are. So the treatment options here are about managing the trauma piece and managing what the triggers are. So if it's stress, let's do stress reduction techniques. If it's coping, let's do coping skills. If it's anxiety, let's manage the anxiety. But ultimately, cognitive behavior therapy is going to be a really powerful tool. Equally, so will EMDR, because again, if there is some trauma there, we can help reprogram that, because sometimes we dissociate because that memory is just too painful. We dissociate, and therefore it's a coping skill. There is evidence and research out there about hypnotherapy. So again, hypnotherapy is really good for processing, getting to those memories in those target areas, bringing it back out, and then using that to move forward. There are, again, lots of self-help techniques, and in my channel here, I've given you lots of self-help techniques. So you're looking at things like mindfulness, muscle relaxation techniques, stress management, coping skills, grounding skills, anything that brings you back, and including that safe space video that we did and guided meditation. So medication then. So medication is an important part of the treatment plan for dissociative disorders. But again, it's normally in conjunction with the other signs and symptoms. So for example, if you've got that piece around anxiety and depression, we're probably going to be using the SSRIs there to help manage that. There is evidence there of, again, using things like mirtazapine, or mirtazapine rather, say it the right way, sertraline, escitalopram, and your normal SSRIs. There is the anti-anxiety medications. So these might be some of the benzos, and that's to manage the anxiety and stopping the anxiety turning to panic, and that panic thing turning into a dissociation. It may be the fact that you need to be prescribed a mood stabilizer to stop that rapid cycling, and to help maintain a balance level. So that might be things like your lithium and other mood stabilizers. Or again, you might need antipsychotic medication such as olanzapine or risperidone to help manage the psychosis in those, and more so in those severe dissociative symptoms. So it all works in conjunction with that other therapy. And obviously the people prescribing it for you then need to be keeping a regular eye on you, because again, some of those drugs requires regular blood tests. So like lithium, you should be having a regular blood test and making sure that your white cell count is in a safe level. Ultimately, with dissociation, you would want a safety plan and a crisis plan. And again, you should be carrying some kind of card on you, because if you dissociate while you're out in public, at least somebody knows what to do with you. We've got those advanced decisions on where to take you and what to do. I have worked with many people with dissociation disorders throughout my career, and it is about planning that. What do we do in this situation? So let's say we're out, or let's say at night you dissociate and you get up and you wander. What do we do with you in that situation? And I've had people where they wear wearable technology, they've got trackers on them, so we know where they are and we can find them in the case of an emergency. It is the case of having that circle of friends, so people know, and other people can keep an eye on you as well. But think about what it is we can do to keep people safe while they dissociate. And it very well could be the fact that you create a safe space in your house, and in that safe space, it's used as a therapeutic area to reduce that tension and to keep you safe while you dissociate. Anyway, hopefully you found that session interesting and useful. My name's Steve. I'm the mental health nurse. That was dissociative disorders. And if you like that video, subscribe below. Take care. Bye for now.